Welcome to the Preoperative Total Joint class presented by Intermountain Healthcare. This instruction is designed to help you with preparations before and after your total joint replacement surgery. Topics to be addressed include preparing your home and packing for your hospital stay, communication with your team of caregivers. We will also discuss what you can expect the day of your surgery and as you move through the recovery process. At this time in your preparation, you are encouraged to identify your partner in healing. This individual is a family member or friend who will accompany you to surgery and support you during the recover process. Your partner in healing will provide emotional support, encouragement, help with your hospital routines, support you in your exercise program, and help provide care at home until you are confident and safe on your own. It is your responsibility to know what your Medicare, private insurance, or other payer benefits are. Please contact your insurance company to understand your anticipated financial obligations. Being in the best health possible lowers your risk of complications during and after your surgery. Before your surgery, we encourage you to work toward goals of daily exercise, weight loss, and smoking cessation. It is important that you manage your blood pressure and blood sugars. If you use alcohol, we ask that you stop 48 hours before your surgery. Infection prevention is also critical. To lower your risk of infection after surgery, you may be instructed to cleanse your skin with a special antibacterial soap before the surgery. When you come home after surgery, you will need to be extra careful to prevent falls and injuries while you recover. This can be accomplished by removing trip hazards such as loose rugs and cords, and moving furniture to allow space to get around with a walker, cane, or crutches. Make sure to stock up on supplies and groceries before your surgery and place bathroom and kitchen items in easy-to-reach places. Additional considerations include testing the height of your seating and examining safety in the bathroom. We suggest that you sit in your favorite chair and see if you can get out of it using only the non-operative extremity. If you cannot get out of the chair on your own with your extremity, you may want to consider something to raise that surface, like a booster or platform, or find a different place to sit. Bathroom safety is very important. Examine your bathroom and consider if you will need a raised toilet seat with grab rails and if you have things to hang onto for safety. Look at your shower and determine if handrails are necessary. For those with tub showers, a shower bench or shower chair may be necessary. Stepping into a tub shower following hip or knee surgery may prove difficult as you are trying to bring your operative leg over the tub. It may be a lot easier to get a shower bench where you can sit on the shower bench, slide over, then move your legs in. Look throughout your home for areas that could be problematic and investigate what can be done before you have the surgery rather than waiting until after surgery. Several days prior to your surgery, you will receive a phone call to register you for your hospital stay. You will be asked about your insurance and may also be asked to pay your insurance co-payment at that time. You will be asked questions about the medications and supplements that you take at home, your allergies, and health history. Be prepared with a list of medication names, dosages, and times taken. The day before your surgery, you will receive a call from one of our nurses who will answer any of your questions and give you specific instructions for the day of surgery. The nurse will also confirm what medications you should take the day of surgery. Be sure to let the nurse know about any changes with your medications, or if you have been sick, have a cough, or feel ill in any way. During this call, you will receive directions and the arrival time that you will need to check in to the surgical services area the day of your surgery. The arrival time is approximately 1.5 hours before your actual surgery. If your surgery is on a Monday, you will receive this call the Friday before. Following surgery, we encourage you to change into your own clothing as soon as you feel up to it. You will want to pack 2 sets of comfortable clothing to wear for physical therapy. This usually includes button-up or oversized t-shirts for shoulder patients and loose-fitting shorts or pants with drawstrings or an elastic waist for hip and knee patients. Because surgical dressings and drains can be large, you will want clothing that can easily fit over these areas. Most patients prefer to wear the hospital-provided socks for their physical therapy, but if you would like to wear shoes, please ensure that they are fully footed shoes and not slippers. If you use orthotic devices or braces for your legs or feet, please bring them to the hospital so that you can use them when you work with physical therapy. You are welcome to bring your own hairbrush, toothbrush, and toothpaste. If you wear dentures, you can bring your own cup to soak them, or the hospital will provide one for you. If you wear hearing aids or eyeglasses, please bring their storage cases with you. For your protection, it is required that you remove all jewelry prior to surgery. This includes wedding rings, watches, and all body piercings. If you use a CPAP machine for sleep apnea, please clean it and bring it with you when checking in for your surgery. Be sure to have your name on it, and our caregivers will make sure that you have it during recovery. We ask that you leave all your medication at home. We will have a list of your current medications, and our hospital pharmacy will provide them for you while you are in the hospital. There is free internet in each hospital room to allow you to use your personal electronic devices, such as a cell phone, laptop, or tablet. Please pack them if you would like to utilize them during your hospital stay, but leave them with your partner in healing for safekeeping while in surgery. Please bring your insurance card and photo ID with you to the surgery check-in. If you have one, we recommend that you bring a copy of your living will or advance directive to the hospital. The registrar can scan it into your electronic medical record prior to your surgery. A credit card may be necessary after your surgery for use with the pharmacy or personal needs. After you arrive at the hospital and you are registered, you will be taken back to the pre-operative room. You may bring in 1 or 2 family members with you, including your partner in healing, and they will be able to stay with you until you are taken to the operating room. You will be weighed and measured and asked to change into a hospital gown. Your nurse will then take your vital signs, review your health and medication histories, ask when you last ate or drank, and verify any medications that you took that morning. An IV will be started to provide fluids and medications that will be given to you during surgery and your hospital stay. The IV that is placed prior to surgery will remain in your arm until discharge. You may be asked to take an oral medication, and you will receive an antibiotic through your IV to help prevent infections. Your nurse will then complete a skin prep on the operative joint, which may include hair removal with clippers and a scrub with antimicrobial soap. Prior to your surgery, you will meet with a member of the anesthesiology team to discuss anesthetic options, which may include general or spinal anesthesia. They will also discuss pain control options, such as peripheral nerve blocks. Pain management options are based on your personal experiences, health history, allergies, and your surgeon's preference. Be sure to speak up if you have any concerns. Once you meet with your surgeon and the surgical consent is signed, you will be taken to the operating room. Your partner in healing will be asked to wait for you in a designated area. After your surgery, you will be taken to the recovery room where you will stay for about an hour. During this time, your surgeon will talk to your family or partner in healing in the waiting area to tell them how your surgery went. They will receive your assigned room number on the nursing unit and invited to wait there for you. Once recovered from anesthesia, you will be taken to the nursing unit where you will stay until you are ready to be discharged. On the whiteboard in your room, your team of caregivers will write information to keep you informed and involved in your care. Our staff wear specific colored scrubs according to their role. This helps you to easily identify them. To help you feel safe and secure after your surgery, We want you to understand the different devices that may be used to help you heal in the best way possible. Due to anesthesia and pain medications that slow your breathing and make you not breathe as deeply as normal, you will be given oxygen after surgery. You may be a little sleepy after surgery, and this extra oxygen will help in your recovery. The nursing staff will monitor your oxygen levels frequently and will remove the oxygen at the appropriate time. A device that helps you to breathe better after surgery is called the incentive spirometer. A caregiver will teach you how to use this device to prevent complications such as increased oxygen needs and pneumonia. Notify your nurse if you are having shortness of breath, chest pain, or problems breathing. Some patients may have a urinary catheter placed to aid bladder emptying. A urinary catheter is a tube that is placed in your bladder to drain the urine into a bag. If a urinary catheter is placed, it will be removed as soon as possible. You may have a wound drain to collect excessive drainage from your surgical site. If you have one of these drains, the fluid will be emptied and the output will be monitored by the nursing staff while you are in the hospital. Protect your surgical site from infection. Care instructions for your dressing will be provided to you at the time of discharge. An important reminder is to keep the dressing dry and clean. Once the dressing is removed, do not submerge the incision site in standing water, such as in a tub, jacuzzi, or pool, until told that you can do so by your doctor.
All patients will have compression devices on their legs. This usually consists of special boot-like leg wraps on each leg called sequential compression devices, or SCDs. These will expand and deflate as air is pumped into them. The compression will help the blood circulate back to your heart, helping to prevent potential life-threatening blood clots from forming. It is important to wear the SCD boots while you are lying in bed. You will be encouraged to get moving and walk as soon as you are safe. It is our goal to keep you safe while you are in the hospital. Our staff will instruct you on how to operate your bed and how to use the call light. You are at risk of falling after surgery. We ask that you use the call light to contact your nursing staff to get assistance before getting out of your bed. Using the call light will help to prevent injury or an extended hospital stay.
As you prepare for your surgery, we desire to help you understand the anatomy of healthy joints and what your surgery may involve. Major joints like the shoulder, hip, and knee have joint surfaces where the different bones connect and glide on each other. These joints are covered with a material called cartilage, which is very smooth and lubricated by the fluid in the joint. A healthy joint should move freely with no clicking, popping, or pain. As the joint starts to become arthritic, we see the cartilage begin to wear away, and pieces of that cartilage begin to break off and cause osteophytes, commonly referred to as bone spurs. These extra pieces of bone that grow around the edge of the joint are the cause of the snapping, cracking, popping, pain, and grinding noises when moving the joint. In a total joint replacement, the ends of the damaged joint are resurfaced by removing the old surfaces and replacing them with a new, smooth surface. Total knee replacements involve removing the end of the tibia bone, or shin bone, and replacing that surface with a smooth material. The part of the upper leg or femur bone that connects to the tibia will have its curved surfaces reshaped by replacing the bad cartilage with a piece of metal that will slide and glide on the new tibial surface. With a total hip replacement, this involves a different type of joint called a ball and socket. This surgery involves removing the entire ball and replacing it with a new ball attached to a metal post that is placed inside the femur bone. This new, smooth ball is then paired with a lined acetabulum or socket that is attached to the hip bone, allowing the new joint to slide and move without pain. Your new joint is designed to function like your natural joint and provide you with renewed mobility. Your recovery and outcome are greatly impacted by both your physical preparations before surgery and compliance with safety and instructions afterward. We emphasize that there are some things that you can do to help your body get ready before the surgery. Good nutrition helps promote healing, so you are encouraged to maintain a healthy body weight. Proper body weight helps make rehabilitation easier for you and will help the new joint last longer. If you smoke, you are strongly encouraged to quit. Smoking contributes to delayed healing and may interfere with pain control measures. You are encouraged to participate in some type of exercise program before you have surgery. Many Intermountain facilities offer prehab or appointments with a physical therapist before surgery. Pre-surgical exercises are specific to the type of surgery that you are receiving, and they are designed to increase range of motion and strengthen the muscles that support the joint. The stronger that you are going into surgery, the better you will move through the rehabilitation process. Many of the exercises that you learn before your surgery will also be used during the recovery process and may be best learned before surgery and prior to any surgical pain that you may experience. It is recommended that you discuss this pre-surgical option with your primary care physician to make sure that it is right for you. A broad range of exercises are available for your individual physical needs. Your physician or physical therapist will instruct you in your customized exercise plan. In this class, you will learn 3 basic exercises that are common for joint surgery patients. These exercises are recommended for use before and after surgery to keep muscles toned and to help prevent blood clots. These exercises can be done in either a sitting or a lying position and include the ankle pump, quad set, and gluteal squeeze. The most basic of the exercises is ankle pumps. Ankle pumps involve pointing your toes as far down as you can and holding for a few seconds. Now pull your toes upward and point towards your nose as far as you can and hold this position for a few seconds. Repeat this up and down ankle exercise 20 to 30 times, several times per day as tolerated. The second exercise is called quad sets. This exercise will focus on the quadricep muscle, which is the muscle at the top of the thigh. For this exercise, put your leg in a position where the leg is not supported, such as laying on your bed with a rolled-up towel under your ankle or sitting on the edge of a chair. Now tighten up the thigh muscle and slightly push down on the knee to make it a little bit straighter. You should feel a good stretch in the back of your knee. Hold for 3 seconds and then relax. Repeat by tightening the muscle again. Push the knee back. Hold 3 seconds and relax. Do this exercise 10 to 15 times each day as tolerated. The third exercise is called a gluteal squeeze. The gluteal muscles are the big muscles that you sit on. This exercise is best done lying down on your back. The objective with this exercise is to simply tighten those muscles, hold 2 to 3 seconds, and relax. Repeat this tightening and relaxing motion 10 to 15 times, several times each day as tolerated. Following surgery, your first physical therapy session will generally be on the same day of surgery. The type of exercises prescribed will depend on your specific surgery and any restrictions that may be in place. Many of these exercises can be done while in bed. You are encouraged to do the range of motion exercises or get up and walk with your therapist or nurse as much as possible after your surgery. Before you leave the hospital, your surgeon will decide the type of therapy you will need to recover at home, and you will be instructed in these exercises by your physical therapist. You might also work with a physical therapist in your home several times a week, go to an outpatient therapy location, or work on exercises independently as outlined by your surgeon. Therapists will make sure that you can do the following activities prior to discharge: walking with your walker or crutches a safe distance, safely using equipment for mobility, transfers, and positioning. You are able to perform your prescribed home exercises for safety and recovery. Pain management is one of the top priorities after surgery. Talk to your nurse about how your pain will be managed. You will be instructed on how to rate your pain level using a pain assessment tool. Individuals react differently to pain medications. Some require more medication, while others may require less. It is important to keep pain controlled. Your caregivers, including your partner in healing, will closely monitor your pain management to maintain a safe balance between making you comfortable and keeping you safe. Anesthesia and pain medications will affect your body in a variety of ways. This may include slower breathing or changes in blood pressure. Constipation can be a common side effect after surgery. We encourage you to increase your fiber intake, fresh fruits, vegetables, nuts, and grains. Drink plenty of fluids, and walking. Taking opioids on an empty stomach can cause nausea. You will want to always take it with food, even if it is just a few crackers. Remember the acronym RICE, which stands for Rest, Ice, Compression, and Elevation. After any activity, you will want to use this method of keeping swelling to a minimum. Rest in a lying position with ice on the incision area. Ice should be applied as needed. Compression stockings or bandage wraps, if ordered by your surgeon, are to be worn 24 hours a day, 7 days a week, until your follow-up appointment. Elevation is so important and the least understood. It means that knees and ankles are positioned above the heart. To achieve this, you must lie flat from the hips to the shoulders.
Most surgeons prefer their patients to discharge back to their home if they are able. Plan on needing some assistance for the first few days after you have returned home. A member of the care management team will meet with you after your surgery. They will ensure that you can return to your home safely and that you will have the resources you will need to be successful. They can help you obtain equipment, such as a walker or crutches, and help you to set up home health and physical therapy. On behalf of Intermountain Healthcare, I would like to thank you for taking the time to learn from this important education. You were shown the general flow and process of a total joint replacement. Please keep in mind that your procedure may vary slightly depending on your specific health needs. If you have questions, please ask your doctor or nurse. We appreciate your trusting Intermountain Healthcare with all your healthcare needs and for letting us help you live the healthiest life possible.